In our next segment from ATSNJ 2023, I believe this was actually the crossover talk from our friends to the West, Pennsylvania, Anne and Beth from Temple University, Dr. Anne Russ, and Dr. Beth Neal were bringing in some really great information about process improvement, quality enhancement, quality assurance, all those great things that we need to be thinking about as athletic trainers. Their title of their talk was "Work Smarter, Not Harder," and very crucial again that we as athletic trainers are efficient in what we do, that we're effective in what we do, and sometimes we need to think beyond just the clinical skills that we're delivering. So thank you, Anne and Beth, for bringing that to this. Beth is the clinical education coordinator and an assistant professor of instruction, and Anne is associate professor of instruction, both of them with the Department of Health and Rehabilitation Sciences at Temple University. So again, thank you, Anne and Beth, for joining us. Anne, first off, can you just tell us what the difference is between quality improvement and quality assurance? What are the two of those and how are they different?
Yeah, so quality assurance is more of a rear view approach, and it's saying, have I met these minimum standards or levels that I need in order to be effective? And so probably the best example with that in athletic training is the CATI standards that programs have to go through. So we're all making sure that the programs are meeting that minimum acceptable level. Mm-hmm. Quality improvement, on the other hand, is more forward thinking, and that can be self-driven. So I like to think of it as mini goals. We can set out these small incremental steps to help us reach this overall goal, and we're driving and striving to become better and better with time.
Got it. So basically what you're saying is that quality improvement is forward thinking, quality assurance is looking at what we've been doing and making sure it's meeting those expectations. So I guess it's a kind of a hybrid, making sure you're doing both in a sense, in an effective way. And Beth, you talked about a really effective strategy, the PDSA, Plan, Do, Study, Act approach to basically reflecting on what we do and making sure that moving forward it's happening even better than it was before. Tell us about this PDSA cycle.
Yeah, so the cycle is a great way for you to be able to take a look at one small segment of that quality improvement process. When we're thinking about the planning process, I think there's two big points to think about is really making sure that you have your root cause of what's going on. So getting down to the exact main piece of the problem and being able to move forward from that rather than kind of putting a band-aid on some other situation. But with that, it's so important that you make sure you know your place in your systems, and that you're doing an appropriate planning piece for where you're at in your career, where you're at within your organization, and really making sure that this is a collaborative piece and not potentially interfering with work that others have done or information you don't know that dates back before you've been there. When we think about that do piece, the biggest piece of advice I can give is keeping it simple, because oftentimes we hear people talk about this like research or wanting to like change the world. Keep it simple, do something really small, something that you're able to actually have potentially happen positively in those next 2 weeks. The study time is important to really just take a look at what you're doing and don't overanalyze yourself. Don't be willing to say you did something you didn't. Just truly take a look back and say, did this happen in that time frame or not? And then that act piece, this is where you get to take and learn from what you did and go on. And if you succeeded, great. If you failed, that's also great. And it's the time to take a look, see what did and didn't work, and also really to see what came in the way for something to not work. And so kind of, regrouping, trying something new, small, and pushing that piece forward. And it's a great way to, kind of keep those little momentums going in that overall quality improvement process.
And two really key things there. Number one is you said, focus, don't get overwhelmed, focus on small things. Those small victories add up, and it's very easy to want to change the world and to take on a huge project. And that's great. That's your vision, but focus on those little steps that'll get you there, and then have those little victories to create some momentum. And the other part of it is just learning from that. It's okay to fail. And you talked to, it's okay to make mistakes and learn from it. This is a cycle, right? So, what are those tips when you're going through this cycle? You've gone through the PDSA, then you're, all right, let's do it again, but learn from that. Why are we cycling, and what are tips for that next cycle?
Yeah, so as you're going into it, take some time during that study to really evaluate what went well and what didn't. I recommend sometimes people keep little notes down because sometimes you'll forget things even in a 2-week time. So just being able to, make those steps appropriately forward. And, maybe it's not the right timing. So maybe try again at a different time or try a different way of approaching your problem at hand are probably two of the easiest ways to approach that.
Absolutely. And Anne, let's get real specific pertaining to athletic training to take these concepts and put them in action. What are some key areas of practice that athletic trainers can target with this PDSA approach?
Yeah, one of the areas that's a good jumping off point is your own documentation practices. So I've had students, certified end students say like, I need to set aside time to do documentation. So maybe they say over the next 2 weeks, I'll spend 15 minutes each day doing documentation. You also could look at the completeness of your documentation. Are you including everything that needs to be in there? Another great way to use a QI intervention is incorporating more patient-rated outcomes into your practice. So maybe it's just taking a pain scale on every patient. Maybe it's using a GROC after treatment. Could you do a patient-specific functional scale as like the gateway prong to get used to it? I've had people have a lot of success with scheduling patients or having patients check in a QI project. So using like a QR code to sign in. And then another good one that people like to do is using more objective range of motion measurements in their patient evaluation. So either initial or ongoing evaluations, and having it's not just like, hey, it's full range of motion, but their knee flexion is actually like 130 degrees.
And I think one thing you mentioned during your presentation, I believe you mentioned about trying to use percentages, right? To show, speak to that real quick too, because some things are very difficult to quantify
Yeah.
with what we do. So, how can you use percentages, or how do you set that up so you can show that success?
Yeah, you should always create an aim statement, and that's what you hope to achieve over that quality improvement cycle with your PDSA planning. So it could just be, again, like over the next 2 weeks, 90% of the days I'm going to set aside 15 minutes to do documentation. And so the percent, it's really up to you. You want to set something that's going to encourage you to work for it, but not be too hard where you can't reach it, or too easy where it's kind of like not worth it doing it. So we try to push to percentages over absolutes, just because like if you're using patients, you have no idea how many people are going to come in with a new injury over the next 2 weeks. And so if you say, I'll do it on 5 patients, you might have like 20 new injuries and 20 new patients, and that would be setting yourself short.
Yeah, absolutely. And then just to kind of wrap that up as well, I think it's important for us to, we want to be objective with those measurements, but there's also a lot of qualitative aspects to this as well. And you could use this if you have a relationship with, other stakeholders or challenges with certain coaches. You could use quality improvement or QA in those relationships as well, and the interpersonal aspects. So it's not just about the tasks, it's about the quality of everything. So I appreciate you mentioning the outcome surveys and utilizing different tools to measure relationships, to measure how we work with others beyond just simply the stats of how many athletes you see or how many treatments you provide. So thank you very much for bringing some awareness to this topic for athletic trainers. Your contact information is in the show notes. So if anyone has any questions, they're doing, between the two of you and Dr. Mansell at Temple, we're doing some great research in this realm, and really appreciate what you're doing for our profession and bringing this stuff to light.
Thank you so much for having us today.
Thank
Yeah,
you.
absolutely. Have a great day.
You too.